welcome to Medical Dialogues. I am Dr. Nandita Mohan. We all know that viruses play a very important role in our lives and ecosystem, and it is not always in a very bad way. So, viruses are a part of human existence and have invaded every possible area of our lives, from our living bodies to the silicon pathways of the World Wide Web as well. So, today, 3rd of October, every year is marked as the Virus Appreciation Day. Virus Appreciation Day, it encourages us to enjoy and respect viri of all the kinds and the incredible impact they've all had in our lives and the world around. So, to talk to us on this issue, we have with us today Dr. Venit Rose.G, who is an MD in General Medicine at Prashant Hospital, to actually give us her valuable thoughts. Welcome to Medical Dialogues, ma'am. We are really happy to have you associated with us today. So, as we mark today as the Virus Appreciation Day, ma'am, if you could just tell us how viruses have actually led to life-threatening conditions in the past?
See, there are millions of viruses. Actually, the viral infections have affected our day-to-day life, everything we all know. In history, in past and all, we had pandemic outbreaks, whatever we had now also. So if we dig in history, if we dig in past, we know that in 1918 we have a Spanish flu, which was an influenza virus. We had millions of deaths in that era. So if we see every 10 years we have an outbreak, and in every 10 years we have a pandemic outbreak that made our life miserable, and that led our life in a different way. So since the Spanish flu, we have seen Ebola virus, we have seen Zika virus, we have seen COVID right now, we have seen dengue, chikungunya, HIV, we have hepatitis viruses, everything. Certain viruses have made our it's a pandemic, and it made our life in a different setup. As we have seen in a COVID-19, we had a outbreak, and we had a quarantine period. We had everything home quarantine. We had our lives in miserable state. We had work from home. Everything have changed. Like that, likewise, the history has also had a pandemic, which probably because of a viral infections.
Definitely, ma'am. We've seen worst of the cases of viruses as well. So now that we're talking about this, can we work towards an environment where actually viral infections can be brought under control? What is your say in it?
I don't think so. See, there are millions of viruses, and we live along with that. Even in this room, I can say there are millions of viruses. We don't know. So it can spread airborne. So I don't think we can get rid of viral infections, and we can control it. But if say in your environment or in your home, if someone is having a viral symptoms like running nose, cough or something, then we can protect ourselves by wearing a mask. And if you know that some viral flu has been running around here and there, by seeing the news or something, you can be very cautious, and you can wear a mask, and you can go. That's how we can just prevent it. I don't think the control is possible in a viral infections. Certain viruses, we have vaccines, we already know, hepatitis and all. Actually, the hepatitis A, E, B, C and all, the mode of transport is different. It's not by airborne. It's if you say hepatitis A and C, it's a food contaminated, water contamination. Hepatitis B, C and all, it's transmitted through a blood related products. So that and all, we have had a hepatitis A, hepatitis B, vaccines have been come. But the other flu and all, we have vaccines for flu. Yearly we can vaccinate for the flu. But the strains are been changing. That's the only thing in viral infections. So yearly the strain can change, and for say if it's a flu viruses, you have more than 130 strains are there for H1N1, H3N2. There are like that. There are a lot of strains. So the varying in strain, the varying in the presentation, and the varying the severity will happen. So yearly once you can vaccinate for flu, you can try preventing it, but I don't think we can control the viral infections, because it's million, and it's we can't see that also, and it can spread like a it's a faster spread. So I don't think we can control it, but we can try preventing it by wearing a mask in house, wearing a mask in wherever you go in a crowded places, or having a sanitizer whenever you're using something. That way we can try to prevent it.
Great. Now that we're talking about it, so now we're talking about the prevention aspect. You just mentioned that we can use masks or we can even use sanitizers to control it. So, can food and fitness also act as a filter strategy for preventing such viral infections?
To prevent viral infections, your immunity should be good. That's the only thing. So we have certain foods that can boost your immune response. See, the vitamin, that's a portion, like what say, good carbs, good fibers, good protein, everything should be there in your complete meal. And you should not skip your meal. You should not be in a deficit calories. If you're planning for a weight loss, or if you want to plan for a deficit calories, you should make sure you're have your all your supplements in your hand. Your vitamin C, your vitamin A, everything should be perfect. So in your daily whatever food you have, make sure you have vitamin C, your vitamin A, your vitamin C and all. It should be there. So your zinc and all, you've already seen in COVID time, we usually give a zinc supplements along with the whatever medications we usually give. So zinc, your citrus fruits. If you say you don't want supplements, I want you everyone to have a good meal with the fruits. So citrus fruits, nuts, seeds and all you can include in your diet, and that can boost your immune response. Once your immune response is boosted, recurrent viral infections can be prevented. So if you're having recurrent infections, like if say I'm getting my infection 2 months once, whether my immunity is low and all, most of the patients ask. In that case, make sure you have a adequate vitamins, minerals and a protein based diet, and make sure you have a citrus fruits, vitamin C, and your nuts, seeds and all should be packed. And even healthy lifestyle, if patient is having, if they're in a sedentary lifestyle, they can have a less immunity. So from my point of view, I'll ask my patients to at least have a brisk walk for 20 to 30 minutes at least. So most of them are having a work from home. They are just sitting in front of a computer, not even stretching, not even standing for few minutes and stretching. So I would advise at least to 30 minutes of a brisk walk, mostly in the morning. But if they're not able to do in the morning, at least in the evening. So once they start doing that walking, and then slowly they'll think of what next. So first 2 months of a brisk walk, they'll itself have an idea. Then what any exercises, floor exercises or gym or whatever, they'll start thinking from their point of view itself. So my suggestion for the patient is to have a healthy good meal whenever they have a viral infections, and to prevent, I'll ask them to have a proper good meal, and I ask them to do at least 30 minutes of walking. That's it.
Wonderful, wonderful. That is a good message given away. So, what, according to you, will be the growth of technology in healthcare as well as in diagnosis to actually detect these viral infections?
Actually, the overall technology has been revolutionarily improved. See, the detection of viral load, the detection of viral infection, there are many tests has been upcoming, and it's very helpful for us. To see, we have a rapid antigen test and all. That is very helpful in a remote areas. But that's not a confirmatory test. The rapid test or a card test, whatever we do, it's not a confirmatory test. But in those remote areas, it will be at least a helpful tool for us. So that is there. The most important test is the PCR test. So whatever viral infection, the PCR is the gold standard test, and it helps in detection the viral load, and it also helps in detecting the virus. So how much is there and whether the virus is there. So that will help in detecting the PCR test. So that's the most important and gold standard test for viral infection. The next is the ELISA test. That is also, it's mostly confirmatory test. So sometimes the PCR can cross react. So in those kind of patients, we usually do a ELISA test to confirm. So there are next generation sequencing test also for a genomic study, so that the strain of the virus. So as I already told, there are a lot of strains. It can change year. Every year the strain can change. So in those kind of situation, the NGS can help in diagnosing the test. So right now, the diagnosing, initially we had difficulty in initial, not now. In years 5 to 10 years back, and all the diagnosing and sending the test to a different lab and waiting for the reports to come and then treating the patient, everything was very difficult initially. Luckily, we have this generation, we have a lot of good tests to detect earlier and to treat the patient easier. So if we detect the patient earlier, the treatment is also is going to be sooner. So I think we have been evolved good in diagnosing the viral infections. In that, the PCR is the best method, what I think. So that helps in detection of your virus and the load as well.
Great. Thank you so much for all your valuable insights on Virus Appreciation Day. It was lovely to be interacting with you today. Thank you once again for joining us at Medical Dialogues.
Yeah, thank you. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.